Greeting EMDR friends, Kambria Evans here, the teaching and learning EMDR consultant. And I am coming today to make this video from my office in San Jose, California, where I have been doing virtual therapy for a full year. It is my year anniversary of going virtual because of the pandemic. And I imagine many of you are coming up on your anniversaries, if they haven't already passed or they're on their way, of having to make a really big shift in your practice. And as hard as it's been for us, I think that this last year has really shaken things up. It's really allowed us to think outside the box. It's allowed us to challenge things that were just the way they were. It was kind of allowed us to challenge the way things have been done for a really long time. And one of those things is this kind of weekly session therapy model, right? So I've made videos before throughout the last year, and a topic I love talking about are EMDR Intensives. I love talking about building a practice that works for you, right? Because it's your practice, it's your business. So we launched the Zero Disturbance EMDR Intensive Design Kit several months ago, and it's been so much fun to see folks buying this all over the world, setting up their own intensive programs and their EMDR practices. And I wanted to make sure that people felt clear about language. What does it mean to do an EMDR intensive versus what does it mean to work intensively as an EMDR therapist? So I wanted to come on here today and kind of clarify that for folks, because I see that people are getting confused about that language as they're deciding how to set their practices up, as they're feeling brave or not brave yet to moving more of like an intensive schedule versus a weekly session schedule. So let's talk about that today, okay? And if you haven't already signed up for Zero Disturbance's free resources mailing list, I would encourage you to do that. I've been making videos since May of last year of 2020 for our EMDR community, and I will continue to do so through COVID. After the pandemic, I will continue to make these videos for us because I feel like it's been such a joy to connect with all of you and get to know you that way. Okay, so what's an EMDR intensive? Why is everyone talking about it? So an EMDR intensive essentially is a bunch of EMDR sessions clustered together. That's it, right? And the research on EMDR intensives is preliminary, right? There's been some studies done, but nothing like a randomized controlled trial, nothing that's really robust in terms of sample size. But so far, a lot of the results from these preliminary pilot studies or case studies have been incredibly positive, right? And intensives in these research studies are designed as a start date and an end date, ranging anywhere from like 2 days to 5 days, okay? And that's it, right? That is an EMDR intensive with a client, and there's no more therapy, okay? So those research studies are looking at that type of intensive work. When I designed the EMDR Intensive Design Kit for colleagues to set it up in their practice, it was really keeping two options in mind because I want everyone to have options. One was an EMDR intensive where a new client would come in, work with them anywhere from a half day all the way to 3 days or beyond, right? And then that's it. It's a defined period of time. But I also set up the EMDR Intensive Design Kit for people to work intensively in their practice. So what does that mean? It means that you can have a weekly EMDR client shift into working with you in more of an intensive model, meaning 90-minute sessions, 2-hour sessions. If you're in person, I've gone as far as 4 hours in person for an EMDR client, okay? So the possibilities are pretty endless when you choose to work intensively, okay? So it's an important distinction because I feel like people are, I'm getting lots of emails, lots of questions. People are feeling anxious, I think, to make sure that they have the right training, to not harm people. And I think that for an EMDR intensive, where you're getting a brand new client in, only working together for a couple of days and then sending them off, right? There are clinical considerations. There are clinical implications to working in that way, which we do cover in the kit. But really, you can also give yourself flexibility and options by offering different services in your practice by offering current clients the option to work intensively and continue working with them, right? So an example of this is I don't take weekly clients anymore. I'm only working intensively, but like I work intensively with a client. I see her for 2.5 hours once a month, and we work intensively, and we don't meet every week anymore, right? Which gives me more flexibility and gives her more movement, right? And especially when I'm working as an adjunct EMDR therapist intensively, that client has a primary talk therapist that they might see every week, and then they come work intensively for a couple of hours with me, and then they go back to their primary, okay? So for working intensively, either with current clients or as an adjunct EMDR therapist when someone has a primary talk therapist, you don't really need additional training in EMDR. If you are basic trained and you have maybe worked towards certification, if you're in consultation, you can work intensively, right? And I think where people get stuck is that they think they need to have some kind of special training in order to do a bunch of EMDR sessions together. But really, it's just what happens in regular EMDR sessions, except you have more time to process in phase 4, which is so cool, right? And you don't have to waste time in a 50-minute session opening up the session. How are you? How is your week? Any updates? Spending 10 minutes there, 15 minutes there, and then having to close up at the end, really only giving you like maybe 20, 25 minutes of processing time with BLS, right? So working intensively gives you a lot of time to really get into a target, to really process, excuse me, and to really see some traction, which is exciting for the clinician. It's exciting for the client, right? So I have loved working intensively, offering both, EMDR intensives that have a start and stop date for one new client, and also working intensively where someone will come work with me in clusters of time ranging from 90 minutes to 2.5 hours virtually, a couple times a month, once a month, right? Before COVID and I was doing in person, I would offer half days here in the office for 4 hours. I would offer 3 days, Monday, Wednesday, Friday. I would offer Friday, Saturday, Sunday options if people wanted to come fly to my office in California and work with me that way. So there's obviously a lot more options in person, but even virtually, you can work intensively, okay? I never process more than 90 minutes in a day, and I do not do back-to-back days. Now, some folks do this. Some folks will process on a Monday and they'll process again on a Tuesday, right? And just my personal clinical preference is that the brain just needs more time to integrate and process the learning, okay? So all of this to say, I want you to feel like you have options, right? We have been in this place for the last year of not having a lot of agency, not having a lot of options, being told what we can and can't do because of safety, which makes sense. But a lot of us have felt this helplessness, this frustration of not being able to choose, right? And our clients have been feeling that as well. And so I feel passionately about this, y'all know this, that I feel like it's respectful to offer clients options and choices to say, do you want to work with me weekly or do you want to work with me intensively, right? That's just for the current clients. And then for new clients, of course, there are clinical implications when you are bringing in a new client and you only have them for a certain period of time, right? Which we cover in the kit. But I want you to know you have both options available to you. So maybe you're feeling a little hesitant in your own EMDR clinical abilities. Maybe you just got trained. Maybe you're almost certified, but not quite there, right? Maybe you want to try working intensively, right? Where you have a current client. Maybe they want to come in for a longer period of time once a month, just so you can see what an EMDR intensive might feel like, right? An EMDR intensive with a new client who's going to come in for, let's say, 3 days of work over the week, okay? So I hope that feels clarifying when we use this language in these different groups and discussions, which I love reading. I hope it feels helpful to understand that we're really talking about two different things. And working intensively, either with current clients or new clients, I think is a nice stepping stone to feeling more confident in your clinical acumen, clinical reasoning skills with EMDR, and that you might feel like you're getting some courage and some bravery to actually offer the EMDR intensive with a new client that has a stop and start time to it. So if you have any questions about this, I would love to hear from you. You can go to the ZeroDisturbance.com website. If you're feeling like you have more courage and you want to try to work either intensively or set up EMDR intensives in your practice, we have the EMDR intensive design kit. It's set up for you to get rocking and rolling in 4 days. I offer you my templates for clients, all my emails I give clients, the curricular map, program design for what an intensive day looks like. I have now 3 bonus modules because I think the coolest part of the kit is that you get to ask me questions along the way so you can be successful. So it's not just like a course you would buy one time or go to one time. It's a conversation where I'm available to you to help you get things set up and be successful. And the bonus modules were really born out of people having wonderful questions. And so I took their questions and I made a bonus module for everyone to watch and learn from. And I will continue to do that. That's just the basic option. We also have a standard option that has a customizable client workbook, which I think really sets people apart when working intensively or working with an EMDR intensive model. It's customizable for each client. It's also customizable for your practice, y'all. So it's a white label workbook, which means you can actually take what I've designed, all, 60 or 80 pages of it that I perfected over the last 2 years. You can put your practice's logo on it, the name, everything, okay? So it's a white label workbook, which means it's customizable for your practice, which makes you look very professional, knowledgeable, and also customizable for each client, okay? Nothing like this exists as far as I understand. And I want you to have this because I want you to offer this service. I have a 3-month waiting list for EMDR intensives in California. So I am passionately pleading with my coworkers and colleagues to get this service set up so I can refer, because the demand is so high. People have been sitting around with very big feelings. People want to feel better. They want to get out of the house. They want to feel better. They want to be done with their trauma, and they want to move forward. And I think people are willing to pay for this type of service, right? So hope this feels helpful to you. Again, if you're coming up on your year anniversary, I hope that you feel appreciated. I hope that you're able to see what you have done the last year, which is pretty miraculous, to support people's trauma while you are also in a parallel kind of trauma experience. And I hope that as you reimagine your practice, whether it's setting up intensives or working intensively or something totally different, I hope you make choices that feel aligned with the kind of life you want to have. Because a lot of us have had a lot of life taken away from us. Either we've lost someone from COVID, or we just haven't been able to live our life to the fullest. And so whatever you choose to do moving forward, I hope that it feels inspiring and joyful to you, and I hope that it's set up to serve you. That's my one hope for you moving forward. So it was so good to connect with you. I look forward to connecting next time, and in the meantime, be healthy and safe. Take care.